We'll be talking on examination. How?
लगा दो
Meanwhile, just I wanted to brief about the fellowship program. So to add the credentiality,
वो आप हमारा चला नहीं रहे उसमें
इस पे चला नहीं रहे online learning platform. So today, whatever the topics you have researched, everything is in the online platform. So I request all of you to go through the online platform before taking an exam.
उस पे अपलोड कर दो
Tomorrow morning,
उस पे वो वर्ल्ड कॉम वाला जो व्हाट्सएप पे तो उसको अपलोड कर दीजिए ना हाँ प्लीज करिए ना तुम लास्ट में करिएगा उसको करिए
30 to 45 minutes online MCQ examination that we are going to announce in the group. So once your online examination is over, we are going to combine both the results and giving a results after 10 days. Once you are completed and successful in FISCT fellowship theory and MCQ Viva OSCE, you must attend the World Cup, where there will be a live surgical workshop. So about different modules like laser, Pilonidal Sinus, all workshops will be there in the World Cup. After the World Cup, the convocation, at the convocation of the World Cup, you will get a fellowship degree. So these are the few questions and doubts every candidate needs to have to solve it. This time the ISCT made everything is very streamlined and everything most of the time it is online. So any doubts you can reach me and also you can post a message in the group. So I have shared right away the video which is going to demonstrate how to log into the platform. So still you will have a doubts, I know that. So our technical team is going to support you in whole journey, and the login credential is for live. So you can access on and off, everything will be updated, every program will be updated in this online platform. Thank you.
Thank you. Good afternoon everyone. Once again I bring greetings from Mandsaur. Today I will be talking about flap techniques. We do understand that pilonidal sinus surgery has also taken various leaps and bounds ahead, starting from the primary closures to the various flaps, the Z-plasties, the Mohan's flap, the Bascom's procedure, to the lasers, and to now to the EPSETs. Many things have occurred. But I still believe in the dictum of old is gold and will forever shall remain. And Limberg Flap is there to stay for stand. It's a very technically not a challenging surgery, but one should know the basic physics out of it. If you know the physics of the flap surgery, inadvertently your flap will be a success and not what is said that there's a recurrence, there's a gapping, there's a failure, there's an abscess. No. So just understand what the basics of physics which I'll be talking about in this flap technique. So these patients, generally come to our OPD, whether we work in our government setups or in our private setups, that they have pain and they say it hurts like a hell when even we bend, walk, sit through it. So we just have to counsel and guide the patient to move through it. Before that, we should understand what basically a flap is. It is basically the reconstruction or repositioning of two things, and accumulation of the donor side as well as the recipient side. And these are the 5 principles which I have devised. So by the end of this lecture, one should understand who the Peter is and who will be the Paul. So 5 principles have to be taken into account. Replace like with like. Think of the reconstruction in terms of units. When we used to learn physics, we used to learn the unit terms. How many centimeters, how many micromillimeters. In those unit terms, we need to understand. And always have a backup plan to it. Yes, sometimes when we are not able to close, so backup plan has to get ready. So it is just like a lifeboat to get you home. And borrow from the Peter to pay the Paul. So equality means a lot. And 5th, never forget about the donor area. These are various different flaps that are there we should do, but traditionally will be explaining about the Z-plasties and the Limbergs. The principle remains the same. Won't go much into definitions. This is the most important diagram one needs to understand. The 2 angles, the transverse as well as the contractual angles. See, one needs to understand for an ideal and a perfect flap, the contractual length increases while the transactional diagnosis it shortens, thereby conversing the physical significant increase in the length. When the flap closure happens, there is a transient increase. So this contractual has to be more, thereby shortening the transverse angle. Only then a perfect flap will recur. I'll show it in my video as well. So these are the theoretical gains that is expected to happen in various Z-plasties, and not Z-plasties, the angulations always remain the same at 30 degrees. But these are the gains that is bound to happen and always happen because of the basic physics nature of it. The geometry remains the same, whether it's a single pit or a multiple pits that occurs. So as you can see, when we make a Z to it, the contractual length is increasing. That is why a perfect flap will recur, and whereas the joints, the pressures won't happen because of the ideal angulization to it. So we always mark, when we do our flap surgery, the various angles are marked at 30 degrees angles, so thereby a 180 degree turnover of the flap completely happen. Where the basic issues occurs, when we, after removing the flap, after removing the pit completely, excising it, the major pressure which happens is, and the gapping that occurs is at when we are fixing at the angles. Now that fixation and that gapping problem can be reduced when the perfect length has to be there. Or we should understand there should be a transverse or diameter length should always be at 8 centimeters if there is a large or multiple pits. Smaller the sinus tract, then both the length should be 4 into 4 centimeters. It should be equal. And we always have a medical scale and a pen available and mark to it. So provisional is not important. The approximation is not there. To have a perfect approximation, exact length and diagonalization has to be there with exact angulations, and that can be very well achieved just by having a simple marker and a pen and nominating it with the physics, the nature of the flaps which we know accountably. So contractual length always should be more rather than the flap length, otherwise there will be a length, and due to the pressure, the flaps tend to open. So we need to understand those things. This is what I regularly teach to my postgraduates as well, and thereby very less recurrences have been seen. And you can see the recoveries as well. See, so basically we need to understand this flap corner thing. So this flap corners is all about the lengthening. See that when you have a large contraction length is increased, this is the position. So the flap necrosis, the most common flap necrosis that tends to happen is at the corners. So these corners is all about the physics, the angulation, the 30 degrees and the length to it. So just by having a simple marker and scale and exactly marking it with the length which we understand, we can actually reduce the most common complication that tends to occur is the gapping, the abscess formation and the recurrence part to it. So this can be avoided only through or by understanding. It's a pure physics surgery to do. So thank you very much, and I once again invite you to WorldCon, and do register today itself. We are having heavy discounts, and all the fellows will need to understand the presence is mandatory for the convocation, otherwise you won't get your fellowship degree to it. Thank you. And to make sure the inventors of various surgeries, the pile surgery, the stapler devices, all would be coming from Morocco, from Germany to first time in India to make you have one-on-one. And we are also planning to have one-on-one roundtable meeting of all the best fellows with some of the legends in the field of endorectal surgery. Thank you.